I'm guessing by now you've heard about that certain popular TV show that returned over the weekend. This is the new edition of it, featuring...
Like shut down, apparently, everything, watching the show.
There was the main character who used a Peloton, the exercise bike, and dropped dead from a heart attack. We're talking about Sex and the City. It's back. And our 9 Health expert, resident cardiologist, Dr. Payal Kohli, is with us now. Everyone's talking about what happened in this show from a variety of aspects, but let's talk about it from a health aspect. We've heard that people exercising can suffer a heart attack, but exercise is supposed to be good for the heart. Does it work both ways?
It actually does work both ways, and I wish that the show had not depicted somebody having a heart attack on a treadmill, but it raises an important learning point, which is that it can happen. So obviously exercise is so healthy for your heart in so many ways, reduces your blood pressure, keeps your weight healthy, helps glucose control. But exercise done wrong is a stress on the heart, and that can actually...
Done wrong, like how?
Done wrong, like too suddenly, so you don't want to ramp it up too quickly. You also don't want to ignore any warning symptoms that might be occurring during exercise, blow them off and say, oh, I'm out of shape, or what have you. And you don't want to exercise too soon after a heart attack. So talk to your doctor before you start an exercise program, but the message here, exercise protects the heart.
So way to just blow the whole story, Tom, by saying, no, I'm just kidding.
I think people have heard about it.
Yeah, they've heard about it. I'm just teasing. But part of it is the reaction of the character on there, like what you do if somebody collapsed. It's a TV show, people. But what should you do? Because some people are like, I can't believe what you did. Right. What should you do if someone collapsed?
So what I would do, and I was actually at a wedding a few weeks ago where somebody collapsed. The first thing, yes,
okay.
the first
well,
thing.
good to have you there. Sorry.
Yeah, the first thing I would do if I was alone is dial 911, put them on speakerphone, and while they're coming on, I start doing CPR. And that's really important because you want to get that blood flowing to that brain. And if you're doing CPR and they're still awake, it's not an issue. The next thing I would do with 911, or if somebody else was there, was to call for help and get a defibrillator. Now, do you guys know where the defibrillator is in this building?
I do. It's down this hall. I do know because someone here used it years ago on someone.
Yeah. So I think one of the most important things we can do is when we're in a place where we go to every day, or even in a new place, familiarize ourselves with where the defibrillator might be, because you could save somebody's life with that.
And knowing to use a defibrillator is what? Because someone may have collapsed but not had a heart attack. There could be something else. So is the defibrillator then dangerous? Most of them seem like they're pretty intelligent and intuitive nowadays. Like they do some research before they actually fire.
Yes, so do not worry about hurting somebody with a defibrillator, because if you don't know how to use it, all you have to do is turn it on, put the pads on the person, and it will walk you through step by step exactly what you need to do. It will tell you if you need to give a shock. It'll in fact even deliver the shock on its own.
Wow, okay. So what about if someone's conscious and you're thinking, I'm just going to drive them to the hospital?
I get this a lot with my patients, Kim. A lot of times they say, oh, I had some discomfort, I thought it was heartburn, I drove myself to the hospital. Never do that, because time is heart muscle. The sooner you get into the hospital, the faster you can get that blood vessel opened. And if you come in through 911, you get in a lot faster. Oh, yeah. And you could have a complication. Your heart could stop while you're driving. You could hurt yourself and other people.
So you arm yourself, be prepared, meaning a lot of people talk about CPR, but how many people have actually taken the class? How many people have known? This is something I talk about all the time and have yet to actually take the class, to know CPR. And I'm using myself as a great example. How would you feel if you didn't know? Right. And you had all these times talked about it, but weren't ready, or know where the defibrillator is, or understand what you might be asked to do. It's stuff we should all know. We should all be prepared to do.
Tom, a few years ago at a family Christmas, I decided to teach everybody CPR as my Christmas present.
Nice.
Great gift.
It was not popular, but it will become popular. We all have to embrace it. And I would say this year, maybe that can be your Christmas gift to yourself and to Kathy. And Kim, do you know CPR?
No.
Yeah.
I mean, I've gone through some
I give people socks.
Classes.
That's such a better present.
Right. That's a great idea. Yeah. I know.
Yeah, save someone's life.
But I do know where the defibrillator is.
Yeah.
Because Kirk Montgomery saved somebody here years ago. Believe it or not.
Kirk the hero. Well,
Kirk the hero.
Well,
be angry
good
if
for
I
all
didn't
of us.
mention him,
Take the time, make it happen. Thanks as always.
Yeah.
It's good to see you, Dr. Payal Kohli.
That is a really good Christmas gift.